Hey y'all, it's Dr. Ruth Doughton here. I'm a board certified adult psychiatrist, and today I want to talk about marijuana and sleep. So just like alcohol, I have patients telling me all the time that they use marijuana to help them sleep. So let's talk about what we know. In general, the literature and studies that we have available on marijuana efficacy and safety and the treatment of various mental and medical conditions is pretty limited, and the availability of marijuana on the market certainly has outpaced that literature. So I will say that the studies we have on the use of marijuana for insomnia do produce mixed results. Overall, what we've seen is a trend that they can improve sleep onset, meaning that marijuana can make it more easy to fall asleep, and that the quality of sleep in that first half of the night is improved, but that during the second half, there's more frequent awakenings and more interrupted sleep. But this initial benefit tends to wane over time. And then we also do know studies have consistently demonstrated that withdrawal from cannabis can cause or worsen insomnia. And so if you're using marijuana for insomnia, you may be setting yourself up for just a short-term solution that ultimately puts you in a worse place than when you started. Now, in all fairness, I have to say that a lot of our psychiatric medications work the same way as far as they're initially helpful, and that benefit can wane over time, and it can be hard to get off of them because of worsening insomnia. So if you are going to choose to use marijuana for insomnia, I would essentially give you the same advice that I would give for any other sleep aid, which is that the goal should be to use this substance in the short term and only as needed, not every night on a regular basis for the rest of your life. Of course, I understand how crucial sleep is to maintaining healthy mental health, and so I understand why people would want some solution, but it's important to not look at that as the solution and rather just potentially a tool to use as you're working on other root causes of your insomnia, like co-occurring medical conditions like sleep apnea, or dealing with underlying trauma that's contributing to your insomnia through individual therapy, or working on lifestyle changes to help regulate your circadian rhythms and other good sleep hygiene habits. So hopefully this answers your questions as to whether or not cannabis is safe and or effective for insomnia. I understand that everyone has a different experience and that this may not necessarily reflect what the literature shows, but overall that's what we know so far. Wishing you all good mental health today, and I hope to see you in the next one.